Assalamu alaikum students. Today we will discuss factors that lead to fluid imbalance and dehydration, causes of dehydration, consequences of diseases that lead to fluid imbalance, fluid loss due to fever, vomiting, diarrhea, oral pain, fatigue, neuromuscular weakness, excessive urination output due to uncontrolled diabetes, and fluid retention due to renal failure, cardiac issues, or cancer, impaired venous return. Factors that lead to fluid imbalances: environmental factors, personal behavior, psychological influences, consequences of diseases. Environmental factor: exposure to sun or high atmospheric temperature, then fluid loss. In personal behavior: exercise without fluid replacement, fasting, excessive fluid or over. In personal behavior, fluid excess or the overhydration in case of the excessive sodium or water intake, venous compression due to pregnancy. In psychological influences, fluid loss decrease the motivation to drink due to depression, excessive use of laxative or tea, coffee, and fluid excess or overhydration if the low protein intake due to anorexia. Having too much or too little water has a health consequences. If the excessive water intake or then excessive water can dilute the level of electrolytes in the blood, and in case of the water intoxication or overhydration is very rare. When it does happen, it is one of the cause of the death. Having too little water in the body is very common. Diarrhea induced dehydration is one of the common cause of the death. Dehydration: when the amount of water in the body is low, then dehydration can occur. The reasons of the dehydration is the low water intake, abnormal loss. Such the loss can occur from severe diarrhea, vomiting, hemorrhage, burns, diabetes, excessive urination, sweating, and use of the certain medications such as the diuretics. And symptoms of the dehydration include low blood pressure, dry skin, fever, and mental disorientation. Chronic dehydration is linked with some diseases. Low hydration status basically increases the risk of kidney stones, exercise-induced asthma, and dehydration. Chronic dehydration increases the risk of kidney diseases, heart diseases, development of the hyperglycemia in case of the people with diabetes. Dehydration can occur in hot weather due to excessive sweating and fail to drink sufficient water to replace the amount of loss. So failure to replace the water loss through the perspiration could lead to 4 stages or of the heat illness that include heat fatigue, cramp, exhausted, or heat stroke. Fatigue, that is due to heat, that causes the feeling of weakness, fatigue, heat cramp, due to loss of sodium, potassium, that causes the leg cramps. If the person is exhausted due to heat, that causes the dizziness, nausea, headache. And treatment include all of these is treatment includes take a bath 3 to 4 times per day, and rest in cool place, drinks fluids. Heat stroke. Heat stroke is life-threatening conditions that occur when the body temperature is greater than 105 or the 40 Celsius. It is a result of the body is basically unable to sufficient cool itself by thermoregulatory mechanism, and basically thermoregulatory mechanism is fail to cool the body itself. Dehydration is the primary cause of the heat stroke, so not enough fluids in the body to maintain sweating production. Cooling of the body is impaired, and signs and symptoms are the dry skin, absence of the sweating, dizziness, trouble in breathing, rapid pulse, confusion, seizures, coma, and possible death. And people can die from heat strokes. In Pakistan, Karachi, it is very common in Karachi. If the in case of the heat strokes, so patient should be put in the chilled water and transported to the hospital. Antidiuretic hormone that's secreted by a pituitary gland, and that signals the kidney to decrease the water excretion. Renin enzyme formed in kidney and released in response to low blood pressure. When low blood pressure, then this enzyme is released, and it acts on a blood protein that called the angiotensinogen to produce the angiotensin 1, and angiotensin 2 is basically compound that form produced from angiotensin 1 that increase the blood vessel constriction and trigger the production of hormone aldosterone, and aldosterone hormone produced in adrenal gland that act on a kidney, causing them to retain the sodium and water. When water is lost, then electrolytes also lost. The treatment include replacement of electrolytes and fluids. Electrolyte content must be checked and correction if it is necessary. In case of loss of the 10% of body water can causes the serious issues. Blood volume and nutrient absorption is reduced when loss of the 10% of body water, and kidney issues, kidney function is also upset. In a loss of the 20% of body water can causes the death. Infants are at high risk of dehydration when fever, vomiting, diarrhea occur, so fluids should be provided throughout the day to prevent dehydration.